Welcome to the DC HEAL Apprenticeship Spotlight, where we explore how healthcare employers in Washington, D.C. are shaping the future of the workforce through apprenticeships. I'm Kianna Cooper, and in this episode, we're going to hear from businesses that have joined the DC Healthcare Employment and Apprenticeship Link, otherwise known as DC HEAL. In today's episode, I'm going to introduce you to Forest Hills of DC. Forest Hills of DC is one of the healthcare employers partnering with DC HEAL to offer apprenticeships in the district. We're going to be talking about who they are, why they chose to become an apprenticeship sponsor, what they look for in candidates, and what an apprentice's day-to-day experience might look like. So if you're thinking about applying to Forest Hills and you want to learn more, stay tuned. Joining me today is Tina Sandri, president of Forest Hills of DC. Welcome, Tina, and thank you so much for joining me today.
Thank you, Kianna. I am super excited to be here today to talk about Forest Hills of DC and our apprenticeship opportunities.
I'm very excited to get into today's discussion, but first, I'm going to just start with some basics. Can you tell me and our listeners a little bit about Forest Hills of DC and what kind of healthcare services you guys provide?
Sure. Forest Hills of DC is a not-for-profit, which means we don't generate funds for shareholders. It all gets cranked back into our operations. We are a mission-based organization with our roots in the Methodist traditions since 1889. That makes us the OG, the original for senior living in the district. And we do it with heart, compassion, respect, and a love for our elders. A quarter of our team members have worked here for more than 20 years. That makes us really unique in the world of longevity. We're also a great place to work certified, which means we care about our workforce, we care about our team members, and we believe that happy team members make for happy residents. The services that we provide include assisted living, which is help with what's called ADLs. That's eating, bathing, dressing, toileting, ambulating, or walking, getting around. That's what we call assisted living. Then we have assisted living memory care, which is all those things I just said, but with the addition of those who are living with cognitive challenges that they're dealing with. It could be Alzheimer's and related dementia issues. And then we also provide skilled services, which are nursing care services with a registered nurse on site 24/7. We also do short-term rehab services. So if somebody has a hip replacement or has an injury, they might need some short-term for a while rehab, and then they'll go back home. We do hospice services for end-of-life care, and then we also do respite services, which is a form of temporary care. So say a family that's caring for another family member has to go out of town for a wedding, or a caregiver just needs a break, which has been shown to help with the caregiver's mental health and just sustainability and resilience. We all need a break from whatever we do all the time. And so that's called respite care. It's a form of temporary care that we can offer to folks in the community as well. We're very inclusive in who we care for. And so that's just sort of the basics of our organization.
Awesome. Thank you so much. That was very, very insightful. So my next question is about why Forest Hills decided to partner with DC HEAL and offer apprenticeships. Can you talk a little bit about that?
Sure. We decided to offer apprenticeships as an innovative move to help grow our own workforce. We believe in growing our own with upward career ladder options in nursing as well as in other careers in the building. So with regards to the other careers even, what do you like to do in your spare time is what I like to say to students often, because I say you can bring that to your work in senior living, because we are kind of a holistic environment where we care about the entirety of the individual, not just their medical condition, not just their family, but everything included. So It's about their medical and their spiritual and their social skills and cognitive and purpose and meaning. And so we wrap all those things in, and we want our workforce to have that as well. So we want to bring in apprentices that aren't here just to do a job, but to be a part of our community. And given that we have these great opportunities, we wanted to partner with DC HEAL in part because our mission statement calls for us to be a supportive community that inspires and engages our seniors and their caregivers. So we believe in innovation, and this is an innovative move. We're looking for apprentices to join us to build out the road on this program so that they're not just doing their job, but getting a solid helping hand to climb the next rung of a career ladder via introductions that we make to other people like colleges and universities, funding opportunities to grants and scholarships, and professional networking opportunities like the Certified Nurse Aid Association nationally that we buy memberships for our staff for. So you get a sense of a learning opportunity to know better, to do better. And this is one way that we apply our corporate value of having a growth mindset.
Now, you guys are just a few short months away from welcoming these apprentices. How are you guys preparing for their arrival? Is there anything that you're doing in particular to get ready for them to be at Forest Hills?
To get ready for our apprentices, we are super excited this first go round. We are working on refining our onboarding training programs. We are vetting and selecting our team members here to be mentors to help guide and serve as role models for our new apprentices. We want to create connections that allow for dialogue where our apprentices can ask questions freely. And for me, the two phrases that come to mind about how we prepare are, if you want to go far, go together, and that it takes a village. So we want to provide that environment that helps our apprentices to develop and flourish in a sense of community.
I love that you just shared that, and it kind of speaks to my next question, which is about the qualities and skills that you're looking for in a strong candidate or in an apprentice. Can you kind of expand on your point just now and talk a little bit more about that?
Yes, absolutely. So, a strong candidate to be apprentice, in my opinion, number one, we start with heart. It has to be in your heart to have a love for and a curiosity about our elders. If you had grandparents, if you had elderly neighbors, you might know what it's like to be in relationship with them. Or sometimes we get folks who've not had that and are curious about developing that relationship in life. So we're looking for that heart connection. And that's probably, I got to tell you, the most important thing, because you have to have that heart in order to really, really shine here. And then I want to talk a little bit about three keywords. One is sympathy. And sympathy is when I can see your needs, and that could include needs for challenges or pain management or just companionship, versus empathy. So one is I see your challenges and needs. Empathy is I feel your challenges and needs. I feel it when you say you want XYZ. Compassion is the next step. Compassion is I want to do something about your challenges and needs to alleviate that situation, to help the situation, to empower the situation. So we're looking for team members that want to bring their compassion to work here. They want to do something about someone else's needs. The next thing I think we need is reliability, and that might look like reliable attendance, a reliable temperament, a reliable commitment and demonstrated work ethic. So think about those things. And then, as I said earlier, we want to have people who desire to know better, do better. You don't have to be perfect. You don't have to know it all. You have to come with this growth mindset to know better, do better. You can Google it, growth mindset. There's a whole series of TED Talks out there that talk about what a growth mindset is. And it basically means that our brains are vessels that we can continually fill with new information to know better and do better. And then I'm looking for a commitment to do the right thing for our residents the first time. And so it's really kind of getting to the root cause of what we need to do to be compassionate, to meet the needs of our residents.
Thank you so much. And so my next question is in relation to some of the ways that the apprentices are going to be contributing to your team whenever they start the apprenticeship. So what are some of their day-to-day, what are some of the day-to-day skills that they're going to learn, how they're going to contribute to the team, what they might be doing? Is there anybody in particular that they might meet when they first get there?
In terms of what our apprentices will contribute to our teams, I think of it on a global scale that our apprentices coming from the HEAL program will be a valuable addition to our workforce because that intergenerational contact will be welcomed both by our residents and by our team members. And they will add to our family-like environment since extended families often have many age groups in them. And that helps us build an environment that feels more family-like. Our apprentices coming out of the HEAL program will bring a youthful energy and a connection to the future. These apprentices are our future. And as Whitney Houston used to say in her song, let them lead the way. And we want to provide that helping hand to let them lead the way. I think the presence of these apprentices will help us further refine and develop this program as trailblazers. So this first group that we bring in are really going to be true trailblazers that they can put that on their resume. We are, Forest Hills of DC, the first CNA apprenticeship sponsor in the history of Washington, D.C., and we are in the prototype grouping for this particular CNA HEAL program. We are super excited for their contributions and work, for the feedback they're going to give to us on how to continually improve this and grow this program. And we are looking forward to the positive energy that they will bring.
Thank you so much for sharing that, Tina. And could you also talk to me a little bit about what a day in the life is going to look like for these apprentices? So what can they expect on their first day on the job?
Absolutely. So while this is not set in stone, in general, it will look something similar to what I'm going to say. So for our apprentices that will be starting here, they will be assigned to a preceptor, mentor person who is experienced as a CNA and most likely will have already been through an apprenticeship program for 30 days with us. So we want people to be paired up with folks who have already demonstrated success because that's one of the best predictors of success is learning from someone who's already done what you want to do and is successful at it. Next, that person will shadow and work alongside for a number of weeks, similar to a skills orientation, without being hands-on until they feel comfortable. And then gradually we will increase the assignment with residents. So you might start off with just one resident to care for and then gradually increase workload. So our CNA apprentices may start by eventually feeding residents, making beds, passing out water, and generally engaging the residents to start out slow so that both the CNA and the residents get to know each other and feel comfortable with each other. Because not everyone who is an elder is comfortable with just someone coming in starting to lay hands on them. So other skills that they'll learn will be learning documentation, taking vital signs, and getting good practice at that. So in general, getting a full assignment of residents that you would care for in a day might be a month or later out, typically after start, once we know that the CNA apprentice is comfortable. And so that's kind of what our CNA staff will look like in the beginning.
Awesome. Thank you so much. This has been a very insightful conversation. I know I learned a lot, and I'm sure that our listeners have also learned a lot about Forest Hills of DC. Before we wrap up our conversation, I just wanted to ask one last question that I'm sure some of our applicants are eager to learn. But is there any advice that you would give somebody who's thinking about applying for an apprenticeship at Forest Hills? So whether that be some encouraging words or tips on tailoring their application, or something that they can take with them when they're moving into the interview stage of applying.
Yes, absolutely. It can be kind of scary when you're going out and looking for that first job, and I would say apply. The early bird gets the worm. We will have limited spots to start what could be a beautiful career for you. Many others, like myself, got started in long-term care in high school. Show us what you are passionate about and have a story about why you want to join our team. Number 3, think about what motivates you. Know your strengths and weaknesses that you would bring to the table. Having some self-awareness and showing that you gave some thought to how you want to grow as a person is a great, great sign of maturity in a candidate. And then finally, breathe and take some deep, slow breaths on the day of your interview. We want you, and we want you to succeed. We are cheering for you.
Thank you so much for sharing that, Tina. And thank you again for taking the time to talk to me today about your apprenticeship with DC HEAL, and to talk to us a little bit more about Forest Hills, and about your organization and your mission and your vision. And so to our listeners out there, if you are ready to take the next step toward a healthcare career, or if you're ready to apply to Forest Hills of DC and their apprenticeship through DC HEAL, you can visit our website at dchealthcareers.org/DC HEAL. Again, that's dchealthcareers.org/DC HEAL for more information and to apply.